Welcome to this episode of ECGs Made Simple. Now, if you're just stumbling across this video, make sure you subscribe and check out the other episodes. With that out of the way, let's get started. Hey, look at that. We have a strip, and you guys now know enough to be able to read this. So let's apply those 5 questions, the measurements, and all the things we've learned to actually identifying this strip. We'll start with the rate. Well, we got a 3-second strip because we have the 2 notches at the top. We got 4 complexes in that 3-second strip. So we know we want to double that. That's going to put us at 8 complexes. So our rate, we're going to put at 80. Now, regularity. You remember how to check that? Let's pull out our piece of paper. Check. Looks regular. I'm good with that. Now, are the P waves present and upright? When we're checking the P waves, you don't have to measure every single P wave, but some of the rhythms that we're going to learn about later, you identify with the P wave and the PRI. When you're looking at a P wave, make sure you're scanning the whole strip to make sure they all kind of look uniform. And when it says upright, what we mean by upright is it's going in the same direction as the QRS complex. If the QRS complex was negative, then the P wave should be negative. But we'll take a look at this P wave. All of the P waves look pretty darn similar. It is going in the same direction as the QRS. So we're going to say, yeah, it's present and upright. Now we got to measure the QRS. So let's take a look at that. Don't get hung up on the exact fraction. I'm going to call that 2.5 squares. As long as it's under 3 small squares, we're good. In future videos, we'll talk about wide complexes, what causes them, and what's going on in the heart. But this guy looks narrow, so we're going to call him 2.5 squares, right? So that'll put him at 0.10. And now we got to measure the PRI from the beginning of the P wave to the beginning of the QRS. So obviously the atria fired. PRI looks like it's right at 4 squares. So we're going to call that 0.16. We'll put that up here. So the rate is normal. The regularity is regular, which is normal. The P waves are present. They're upright. Got one for every QRS complex. My QRS is less than 0.12 and my PRI is less than 0.20. Everything on this looks normal. There's only one rhythm that meets that criteria of all 5 of these questions being normal, and that is normal sinus. Now let's see what we have next. Okay, so what do we have here? Feel free to pause the video and try to figure it out on your own, but I'm going to walk through it kind of slow, but I want to give you time to be able to determine what kind of rhythm this is on your own. So as far as rate, we have 7 complexes in a 3-second strip, so we know we double that, so that's 14. And we add a 0 to the end of that, so the rate we're going to call 140. Now, regularity. Let's pull out our handy dandy piece of paper, see if it's regular. Yep, looks good to me. All right. I think we can call that regular. So the only thing abnormal at this point is the heart rate. Now let's take a look at the P wave. Okay, well, P wave's upright. It looks pretty uniform with the other P waves on the strip. Not seeing anything alarming, so we're going to say, yep, P wave's present, upright, and we have one for every QRS complex. Now let's go ahead and measure that QRS. Oh, looky there, we have about 2.5 small blocks again, so we're going to call that 0.10. We'll put that up there. And now let's measure the PRI. Look at that. 4 small blocks, so it's 0.16. Now is your time to shine. So the only thing abnormal with this particular strip is the rate. We know that it's sinus because we got a P wave with a normal PRI. We know it's regular. So that means this rhythm is, hopefully you said, sinus tachycardia. All right. Let's try one more. Okay, woo, that's a scary one. All right, so we have 2 complexes on a 3-second strip. So we have a total of 4 complexes. So our rate is the scary low number of 40. Let's see if it's regular. Well, we only have 2 complexes. So in this situation, what we got to do is just extend out the strip and then continue marching that down. Yep. He looks regular, so we'll call him regular. P waves, they look all identical to this one. I'm not seeing anything alarming or any drastic changes in shape. They're in the right direction. Every QRS complex has a P wave, so we're just going to say yes there. Let's measure that QRS complex. Looks pretty narrow, which is a good thing. I'm going to call it two small blocks, 0.08. So we'll go ahead and put that there, and then we'll measure the PRI. PRI is a little smaller too on this one. It's going to be 0.12. So three small blocks. So now the regularity is normal, P waves are normal, QRS and PRI are normal. The only thing abnormal is the rate, and it's slower. So we have a sinus rhythm with a slow rate. So we call that sinus bradycardia. I know we've been harping on these three rhythms throughout the course of the video. So let's move on and learn about some other rhythms that originate in the atria. And that's it for this episode of ECGs Made Easy. Now, to catch our other episodes, go ahead and click right here, and I'll see you over there.